Hi, my name is Teresa, and today I would like to talk to you about functional analysis of delusional speech. Hope you enjoy. In order to understand what delusional speech is, from a behavioral point of view, we first have to understand distorted tact. Distorted tact is a kind of tact that is result from the alternation of stimulus control because of generalized learned reinforcement. And because of differential GLI history, people tend to respond differently to the same stimulus. So that means the same stimulus can have multiple meanings depending on who is interacting with that stimulus. Sometimes speakers may invent stimulus control that doesn't exist. It is because those stimulus control or the similar stimulus control might have worked in the past. And one of the examples of distorted tact is delusional speech. Some authors suggested that delusional speech can be defined as intelligible but contextually inappropriate words or phrases, and is usually associated with underlying psychiatric illnesses, and which is such as schizophrenia, which is usually treated by medication. And the behavior is often defined in the absence of observable discriminative stimuli. It is because it is often assumed to be controlled by private events. So from a behavioral standpoint, we first look at delusional speech as an operant, and also it is sensitive to environmental control and reinforcement contingencies such as attentions or escape from work demand. And it also carries functional relations between verbal behavior and the environment. So as we all know, for a behavior to occur, we need to have the presence of SD, which signals the availability of reinforcement, and also in the absence of S delta or aversive stimulation. So one might ask, why delusional speech still exists in some individuals? So some behavioralists suggest that the apparent absence of maintaining consequences or the presence of occasional aversive consequences may be the requirement for reinforcement to be available in the future or in some other occasions. So it's almost like the reverse case of the little boy who cried wolf. They also suggested that delusional speech can be understood as contingency tactors. What that means is verbal responses can tact highly complex and confusing contingencies. Unextended text tell us about the situation. However, metaphorical extensions tell more about the speakers, which reveals the contingency that governs the verbal behavior. For example, it is quite often for a writer or for people to use metaphorical extensions to infer some unknown conditions or facts about a writer. Moreover, metaphorical contents are often noted in delusional speech. So the distinction between intraverbal, metaphorical, and other extended forms of verbal behavior are very important for a successful treatment plan. For example, if metaphor is involved in delusional speech, searching for the reference is very important for a successful program treatment. However, if the verbal behavior is not a tact of a contingency such as intraverbal, then the search of the missing reference will be a waste of time and effort. Behavioralists also suggested that verbal behavior are under multiple sources of control, which is antecedents and consequences. And verbal behavior often have multiple consequences, some are more immediate than the others. And behavior that once might have been a product or a byproduct of one set of reinforcement contingency may later become under the control of different institutional or social contingencies with the original referent lost in transition. So here's an example of how a seemingly delusional speech or statement made by a 19-year-old female psychiatric patient can be understood from a behavioral point of view. So this statement is often repeated by this female patient, and especially in front of a young male patient in the same unit. She kept on saying kings of hearts, queens of hearts, there's a cover in the room. So the examiner suggested that the queen here was referring to a friend of hers who recently won a beauty contest. So she was the beauty queen. And then the beauty queen's boyfriend, his nickname was Cupber. So this statement could be understood as a text desiring, expressing her desire of wanting to be in a relationship like her friend and her boyfriend. Again, this statement was noted frequently in front of a young male patient in the unit. So the examiner also suggested that maybe this female patient was attracted to this young male patient, and he was her Cupber in the room. So below is some common behavioral treatments for delusional speech. The first treatments often used is DRA, extension. Punishment procedures such as token fines, time are often used too. Desensitization might be part of the program as well. So today I would like to share 3 studies with you. And in the first study is about a 26-year-old man with traumatic brain injury and delusional speech. At first, his delusional speech were considered as brain injury symptoms. It is because before his car accident at the age of 16, no delusional speech was noted. Here are some backgrounds or facts about this study. Delusional statements were defined as obviously false and non-contextual verbal behavior, such as Britney Spears coming to see me tonight. Functional analysis was conducted. DLA and extension were used as treatment, and an AB design were implemented. There were a total of 20 treatment sessions, and each of them was 12 minutes long. And there were a total of 4 treatment following sessions at the 6 months, 1, 2, and 4 year time. So the result of this study showed that delusional statement for this patient was maintained by attention, and intervention effect was able to sustain at the 6-month follow-up time. However, delusional speech went up at the 1-year follow-up, and it was correlated with the presence of a new staff member. But after one training sessions with that new staff member, the delusional speech went down to previous treatment level, and then the effect was able to maintain at 2-year and 4-year follow-ups. So a few things that I would like to point out about these studies with you. The first thing is the result was consistent with earlier findings, and also this study demonstrated the utility of functional analysis and treatment for people with traumatic brain injury and frontal lobe syndrome. Treatment, DRA and extension were effective and also long-lasting. However, data collection on treatment integrity was absent in the follow-up sessions. So delusional speech, whether or not delusional speech was directly result from the treatment, cannot be confirmed. So the next study I would like to share with you was about a 23-year-old man with ASD and mild MR. So his definition of delusional speech was defined as below. Again, functional analysis was conducted, and there were 30 sessions in total, and each of them was 10 minutes long. DLA and extensions were used as treatment plan as well. So the findings was unusual speech for this man was maintained by attention as well. Intervention was successful in reducing unusual speech and also increasing appropriate verbal response. Functional analysis has a valuable role in improving conversational skills for people with ASD. DRA and extensions were effective procedures to decrease inappropriate speech and to increase appropriate verbal behavior. However, generalization of findings in daily work environment for this individual was not established. So the last study I would like to share with you was about a 25-year-old man with moderate MR and psychiatric disorder not otherwise specified. His delusional speech was defined as sexually inappropriate remarks and illogical or irrational statements such as, there is a purple mouse in my hat. And his symptoms of delusional speech was considered as symptoms as underlying psychiatric disorder. Functional analysis was conducted, and there were 25 sessions in total, and DRA was used to decrease this delusional speech. So the results showed that inappropriate verbal behavior was maintained by attention from others, and treatment was effective in controlling verbal behavior. DLA was associated with decrease of inappropriate verbal behavior and also the increase of appropriate verbal response. And the finding supports other people's work, and also it also suggests that functional analysis can be extended to people with dual diagnosis. So I'm going to conclude my presentation by pointing out that although the three studies that I've mentioned today, they all demonstrate effective treatment for decreasing delusional speech. However, if we go back to the previous or the earlier part of the presentation, we're talking about the importance of stimulus control in the very beginning, which produced the verbal response from the beginning. So all these studies focus solely on reinforcement contingency without addressing the stimulus manipulation. So in order to have a comprehensive and effective treatment program, I think we should not only involve the reinforcement contingency, but also take a look at the antecedent. Thank you, and hope you enjoyed the presentation, and I'm looking forward to hear your comments and questions.